It's 8:45 right now, and a vote is expected later this morning, which could bring about a major change for the timing of children's vaccines.
Yeah, tensions erupted during that meeting between the vaccine advisory panel appointed by Health Secretary Robert Kennedy and outside doctors over these vaccine changes. So what does it all mean, right? Joining us this morning to explain what this could mean to New Yorkers is New York City Acting Health Commissioner Dr. Michelle Morse. So great to see you, Dr. Morse.
Thanks so much. Good morning.
So the panel set to vote on the hepatitis B vaccine. That vote hasn't happened yet, but of course the big question is if they do delay it, because you get it when you're a newborn, what are the risks?
So even if they decide to delay the recommendation for the vaccine, the fact stands that in New York City and New York State, our standard of care is to still give that neonatal birth dose of the hepatitis B vaccine.
Yeah.
And the reason I want to emphasize that is because even if that vote happens today and they vote to delay, our physicians, our nurses, everyone here in New York City should still abide by our standard of care, which is extremely safe and has been in effect for 30 years and has decreased hepatitis B viral cases by 99%.
But if the vote does happen and it goes through, right?
Yes.
Does not giving it to a newborn, does the risk go up?
So 100%. What we know is that the earlier that dose is given, the better. It is a 3-dose series of the hepatitis B vaccine. Okay. And the recommendation is if the mom has hepatitis B, the dose may be given within 12 hours, and if not, within 24 hours of birth. That is safe, it is effective, and what we know is that if we didn't do that, about 90% of the babies that acquire hepatitis B would go on to have chronic liver disease and potentially liver failure. So this is why this dose is so life-saving and protective. And what I worry about, of course, is that this ACIP vote is just bringing confusion.
Yeah.
No new data has been presented that gives us any concern that that neonatal dose or the 3-part series is in any way unsafe. And so I hope that New Yorkers understand that in New York City, no matter what happens, we are going to continue to make sure that all of our providers and all of our babies are protected against hepatitis B.
So it doesn't seem like we will feel or see any kind of a change, no matter what the vote is.
The vote today does eventually have bearing.
Okay.
And the reason I want to mention that is because eventually what happens is that the CDC director, acting director, will have to adopt the ACIP recommendations.
Right.
That doesn't happen for usually days to weeks after a vote. And even if and when that happens, again, we still have the authority here in New York City and New York State about our vaccine schedule.
Right, so regardless if it passes or not, you can still say it has to happen.
Yeah.
Correct.
Is the panel considering any other changes?
We are extremely concerned about other changes the panel might be putting forward. Unfortunately, they have made lots of last-minute changes to their agenda. They've not allowed us to testify, unfortunately. There have been many attempts to really bring a more science-based and evidence-based perspective to the meetings. That has not happened, and there has been tremendous turmoil in the members of the ACIP committee. That's been changed completely in recent months. And the biggest concern, again, is that parents, families see all these proceedings and get confused.
Yeah.
I want to make sure that New Yorkers are not confused. We in New York City are still following the recommendations of the American Academy of Pediatricians, our OBGYNs, all of our experts to make sure New Yorkers are safe.
Okay, should be continued for sure on that front. While we have you here, I got to ask you, all over social media, people are talking about this new strain of flu that is worse than the other cases of flu, and people are saying, well, it could go past the flu shot. What are you hearing about this new strain?
So we are in peak respiratory viral season right now. Our flu cases are going up 100% to 150% week over week. So flu is 100% out there.
Yeah.
And at the same time, this flu vaccine, it doesn't specifically address the subclade K that everyone's talking about, but it does still provide protection, in fact. And so that's the message to New Yorkers. Yes, we are seeing this subclade or specific strain evolve, and the flu shot. No, so what we're seeing is that this flu shot still offers coverage. In fact, in the UK, where their cases have gone up even earlier than ours, 70% of kids that got the flu shot still were protected from being hospitalized or something worse. So the current updated flu shot still provides significant coverage And everywhere you go, there's going to be flu in the air, so get the flu shot if you haven't gotten it.
But this strain, because you look on social media and it's like,
Yes.
worse than ever.
Yeah,
don't they say it every year?
Talk to your doctor. Talk to your doctor. Don't follow TikTok.
Yeah.
Definitely, if you have questions about it, talk to your doctor. What we're seeing is that this strain is not more virulent.
Okay.
However, again, it is causing increases in cases. But this is the time of year where we see that. The flu shot is life-saving. So I hope every New Yorker has gotten an updated flu shot and an updated COVID shot, because we do often see the COVID numbers start to go up a little bit later in the season.
Yeah.
And thanks to you, we both got ours.
Yes.
Yes.
So thank you so much. Have a safe and happy holiday.
Thank
and
you.
healthy one, too.
Thank you,
Thank
Doctor.
you. Thanks.